Hello and welcome everyone to the Thermographic Diagnostic Imaging and Health Through Awareness webinar. My name is Leisha Getson and I'll be your host this evening. Before we begin, just a little housekeeping. Tonight's presentation will be about 45 to 50 minutes, followed by Q&A. You should be able to hear me and the speaker as well as follow along with the PowerPoint presentation. To the right of your screen, you see a little chat box. If you have a question, please type it in and submit it, and we'll get to as many questions as possible at the end of the presentation. If for some reason you get cut off from the webinar, you may be able to sign back in, but don't worry, the webinar will be archived and will be available in a day or two on our website and then also on YouTube within a couple of days. So let me introduce our speaker for this evening. Tonight's speaker is Dr. Sue Massie, a board-certified naturopathic doctor as well as a certified natural health professional. The title of Dr. Massie's talk this evening is Lyme, the Great Imitator. Dr. Massie is going to share some of her personal experience as well as the latest information on Lyme disease. So this is a big topic, Dr. Sue. Lots of people interested in this, lots of people needing help. So we're very happy to have you with us this evening. Looking forward to your presentation.
Thank you so much, Leisha, for having me, and thank you, Dr. Getson. I am very honored, and it is such a blessing for me to be here. This evening, what I'd like to talk about is to share my story about Lyme disease, my own personal story, and what I have experienced, and also what I've learned so far.
Great.
Next slide. Yes.
Next slide. Okay. There we go. Did it change for you, Dr. Sue?
Yes.
Okay.
Thank you.
Mm-hmm.
Okay, so I just, again, thank you for this. I'm going to go into detail a little bit about Lyme disease, but this is not about the history of Lyme and, statistics and facts and so forth. This is more a personal story, and I just want to relate to people out there that are, having a multitude of symptoms and not quite knowing what's going on with them. Or this is also for the person that has been possibly diagnosed with Lyme disease and doesn't still understand what's going on and why am I not getting better. Next slide, please.
Okay.
This PowerPoint presentation is an accumulation of information that I have collected over the past 22 years, as well as, like I said, my own personal experience. It is my choice and it's my heart's desire to share this information. I am not a medical doctor. This is not meant to diagnose or to treat or to replace any medical treatment. No two people are alike, so there is no cookie cutter remedy for all. This is on an individual basis, and that's how I look at my patients when they come to see me. Next slide. Lyme has affected my life. It started for me, I thought, in the mid-90s, but actually when this all came to a crush for me, I realized that this went way back when I was probably about 10, 11 years old. Because back then, I remember very clearly in 6th grade in June, lying on a little hill on the side of my elementary school with other friends, and we were looking up at the clouds, making animals out of them. And I remember very clearly saying, what are those little black worms, those little black squigglies? And everybody was like, what are you talking about? Never thought twice about that until I learned many years later in 95, 96, that those little black squiggles are what they call black floaters. I actually experienced those, long ago. I also had a strep throat many times, to the point at one time when I was 21, I was working for Eastern Airlines and I was grounded and actually put in the hospital on IV for 10 days because I was so critically ill with strep.
Wow.
Allergies was another big issue for me. When people talk about getting chronic sinus infections, to me that's a red flag. There's no coincidence that you get a sinus infection. There's a reason for it. So allergies are a big thing also. It could be seasonal allergies. It could be, sinus infections, like I said, and it also carries over into the dental, which I'll talk about later.
Great. I'm glad you just brought that up. Just to interject, people think that having sinus problems is just normal because you live in New Jersey, but it's not. We see that with the thermogram. So it's your body telling you something.
Awesome. And it's
Sorry to
that
interrupt you.
no, please interrupt. Absolutely. Because it's an inflammatory response. That's
Hmm.
exactly what it is. And I love thermography and I love what you do, Leisha. And I'm so grateful to be a patient of yours for so many years because you've helped me tremendously.
Oh, thank you.
Yes, thank you. In 1996, basically, I saw a tick, a tiny little black dot on the back of my right hand after visiting Alaire State Park with my youngest, which was he was just not even a year old at the time. We did not go in the woods of the Alaire State Park. We just literally went on this little train ride, got off the train ride, and came home. And the next day, I had this black dot in the back of my right hand that's tiny, tiny, and I saw a bunch of little black things crawling up my right leg. And I said, oh my gosh, I think I know what these are. Now, again, this is back in
Yeah.
1996, so Lyme was not talked about. But my father at the time was diagnosed way back in 1982, and he lived in Monmouth County here in New Jersey, where I live. And I was called to the hospital at midnight back in 82 saying that your father is dying. We don't know what's wrong with him, but he's got this weird rash all over his head and his chest and whatever. And I rushed to the hospital and they said, we don't think he's going to make it through the night. So that
Wow.
was not a good thing.
Wow.
But what happened was the next morning I got a phone call that they found out that they gave him something called erythromycin. Oh, no, I'm sorry. It was tetracycline. And they said, we think he has Rocky Mountain spotted fever.
Wow.
So I was like, okay. And he seemed to have recovered. So that was it. But he had a multitude of bites and symptoms, past that. But that was my first introduction. So I
So
said,
he had Lyme?
oh, yeah.
Yes.
Yes.
Oh, okay.
Yes.
Wow.
Yes.
Okay.
Yes. So at that time, I'll go into my family and my husband next, but at that time I saw what's called an LLMD, or a Lyme literate medical doctor. That's a doctor that knows about Lyme disease, because I tried everything else at the time of trying to figure out what's wrong. And, he gave me a diagnosis of Lyme through a clinical diagnosis and I'll explain that in a little bit also when I talk about testing. But the bottom line was that I was put on antibiotics, and that was, again, for 5 years. And there were about 3 antibiotics at a time I'd be taking. There are ones that they don't even have anymore. One was Suprax, one was Dynabac. I mean, these are antibiotics that were from long ago. And at the same time, I was having all kinds of mood swings and depression and so forth. And so they put me on antidepressants as well. I saw the top Lyme psychiatrist at the time also, because he's here in New Jersey. So between pain meds and sleep meds and everything else, and I'm a person, I never even took a Tylenol, so it was very weird to be taking all this medication, but I literally felt like I was going to die.
Oh, wow.
Yeah. So I had all the body aches and, all the issues of symptoms from headaches to neck pain, but I never had joint pain. I never had a bullseye rash, never had joint pain. So the bullseye rash, less than 20% of the people get a bullseye rash, and less than 30% even see a tick. So like I said, I was bit a multitude of times as a child and through my teens and so forth. So that was another thing.
Right.
So I also felt at the time, and I know a lot of people go through this also, where they feel like their body is stuck in the on position. In other words, like you're always running, your brain is racing. You describe it. I used to describe it like I was an electric blanket always plugged in, like that vibration, and you put
adrenaline's always up, you mean?
adrenaline is always up, but I didn't know what that meant. I just couldn't turn off my brain. So it was ADHD, told that for many, many years back in the 70s or 60s, 70s when I was going to, school and so forth. They didn't diagnose it back then, but that's basically what it was. I couldn't even sit in my chair at school or whatever. But anyway, always plugged in. So I've learned, obviously, that that's the sympathetic dominance. It's basically your autonomic nervous system, which is everybody's nervous system, and you've got the gas pedal, which is the sympathetic, and then you got the brakes, which is the parasympathetic. And most Lyme people are stuck in the sympathetic, which is the gas pedal. It's go, 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 and there's no brakes. So when you have a lion that chases its prey because it's hungry, that's the sympathetic, and it runs, grabs the feed, eats, and then it lies down to digest, which is the parasympathetic. So when we're low in our parasympathetic, okay, that's usually a potassium deficiency. So I personally, started taking some potassium before bed, and guess what? It helped me. It helps you to fall asleep, number one, but it also calms down the sympathetic. So that was a great thing also. And I also learned about 10 years ago that potassium is fantastic for the pituitary. because I see a lot of patients that come in with, all kinds of cysts and tumors on the pituitary. And it could be a potassium deficiency all those
Oh,
years.
wow.
Hmm.
Wow.
So that
So
was
that's
really
great for anybody taking a little potassium before bed, or just people that,
absolutely.
oh, okay, great.
Absolutely. We are a very mineral deficient society, very mineral deficient, and that's due to our food source. And I mean, you hear about this everywhere, so I'm not
Right,
going to go on about that. But,
right.
so taking minerals is absolutely a must. If you look at your fingernails and you see a tiny little black lines that go vertically, okay, from where the white part of your fingernail into the pink bed, you see the little black lines. That's mineral deficiency. So there's a
Really?
sign right there. Hmm.
Uh-oh.
And funny enough, about 2 weeks ago, I started getting them because I haven't been taking minerals.
Oh,
So
uh-oh.
I myself,
Everybody's looking at the fingernails right now.
yes, yes, yes. And the other one, while you're looking, if you see little white spots, any little white dot on the pink part of your fingernails, that's a zinc deficiency.
Oh, wow. Okay.
Yep. And
I'm writing all this down.
And if your feet stink, you need zinc. That's another way to know that
Really?
Yes.
Oh,
Yes.
interesting.
Yeah, sorry, men, but that applies a great deal to men. But they need zinc. That's one of the biggest things. Zinc is one of the, calcium is the number one mineral that we have in our body. Magnesium is number two. That's an absolute must,
Right.
especially with Lyme people, because magnesium is the relaxer. So that has to do with the heart and sleep and, just relaxation. Charley horses, when your toes cramp and your legs cramp, I use magnesium lactate is the particular one. It doesn't affect the bowel at all, but it works fantastic. Magnesium lactate.
Okay, magnesium.
So
Real
anyway,
quickly, can you just tell us which potassium to use?
I just use a potassium. I use Allergy Research Group.
Okay. All right.
Yeah.
Thank you.
Yep. So anyway, like I say, 5 years, I ended up from all these medications and, my diet was affected. I actually became anorexic because everything to me just tasted disgusting. I didn't want to eat anything. I had a lot of lethargy, fatigue. I didn't care about anything. You'd care, but you just can't care, and so forth. I'll go into that later. So the bottom line is I ended up paralyzed. I came home one day. I was feeling kind of weird that day. I remember very particularly, I took my little one to nursery school and came back to my house and I literally collapsed on the floor and I just went paralyzed from the neck down. And
Wow.
yep,
Oh my
yep.
gosh.
And that's when I first heard about something called ALS, Lou Gehrig's. I had the swallowing problems, speech difficulty. I mean, I had a multitude of problems. This wasn't just, I'm, doing my life and then all of a sudden, this happened. This was like I say, a whole plethora of symptoms, which we'll go into later. I have in the present, the PowerPoint here.
All right.
Okay. So, that was the point finally in 2001 when I said, I'm done. I have to, I just quit all drugs, everything. I felt what I called toxic back then. And I knew I needed to do something called detoxing. And this was before it was popular, and everybody's talking about detoxing. But anyway, so I started learning all kinds of things about detoxing and so forth. And like I said, I'll get into the rest of that story later.
Okay.
So obviously I recovered. 2005, I ended up with a diagnosis of intraductal carcinoma, breast cancer, which again, through thermography, which was amazing. Like I say, I'm a huge fan of thermography as opposed to mammography. Mammography, if you have breast cancer and you go and squish the breast, what do you think that's going to do to cancer cells? So not a good idea, but that's everybody's individual choice and I respect that. But thermography is the best thing to do because it detects it could be up to 10 years in advance. And it's just a fantastic thing to do. So again, I highly recommend it. Okay, so obviously, like I say right now, great health. Okay, next slide, please. Yes, thank you. Okay, so how Lyme has affected my family. What happened was initially it was my husband that started with the symptoms. I got together with my husband in 2002, and within a year or two, whatever, my husband was battling things like depression. He get severe symptoms. He would get this tachycardia where his heart would race out of his chest. And literally, we'd rush him. I'd have an infant in my arms, 5 other kids, and rush to our we have 2 hospitals here, rush to the emergency room, screaming, my husband's dying, like, what's wrong, what's wrong? They would take him in, and by the time the doctor came in to see him, and then we, go see cardiologist, everybody kept saying to me, this is impossible. Nobody can have a racing heart like this. And I'd be screaming, don't tell me they can't. He's standing right before you. What is wrong with him? So finally, after quite a few years of this, my husband ended up with heart surgery. He had a catheter ablation, where they went in through the groin and went up to the heart and made burn marks to try to interrupt the tachycardia.
Yeah.
But what's causing that tachycardia, in my humble opinion, again, because I've seen it over and over, my 22-year-old has this exact same thing. It comes from the babesia. And babesia is a co-infection to Lyme. Again, we'll talk about it later, but that racing heart, and I found what calms that heart down right away, again, is not only potassium, which sometimes I use organically bound minerals, which is mostly potassium. I also have a little formula that I use. I use another one called Cataplex E2. E2 is, you chew on it, and it's like nitroglycerin for a heart attack. It gives oxygen directly to the heart. It's a fantastic product.
Cataplex E2, is that from Standard Process?
Standard Process, yes. You chew them, and it stops it right away, a racing heart. It's fantastic.
Thank you. Listen, just one second. Lauren, who's asking, is this being recorded? The answer is yes. I'm just answering the question right now because I don't want to write out the answer because I don't want to lose the PowerPoint. But Lauren, yes, this is being recorded and will be available. Sorry, go ahead.
No problem. So my husband would describe his symptoms initially as buggy eyes. His eyes would go twitter, like do, a little bit. Radiating jaw pain, a TIA, which is a transient ischemic attack. Basically, it's like a little mini stroke in the head. You kind of feel these twinges in your brain. Severe fatigue. I mean, like you just can't even move. And then the muscle pain, severe muscle pain. He's ended up so far with shoulder surgery, foot surgery, hernias. I absolutely believe hernias are directly linked to Lyme, and I'll explain, all these surgeries as well. Has a lot to do with uric acid crystals, okay, and also bone spurs. And if you're dealing with uric acid crystals, number one, you need kidney detox, okay, and cherry juice. Cherry juice is fabulous for it. And for bone spurs, also, it's definitely low phosphorus, okay? So Phosfood liquid I use by Standard Process. Another great, thing.
Okay.
And then other surgeries, as you can see, sleep disorders. Oh my gosh, my patients don't sleep. My husband used to have a very hard time with this, falling asleep and staying asleep, which again, I'll get into this later. Okay, I've got more information on this. Okay.
Great.
Next slide, please. My kids, all six of my kids, back in the 90s again, all had weird symptoms, stuff going on. So, of course, we marched them all in, had them all tested and so forth, treated with antibiotics, special ed, the 504 plan or an EIP plan, which I highly recommend if anybody has children that are having a difficult time in school. You get them in and it doesn't mean that they pull the child out of the class. Nobody knows they're labeled or anything else. What it means is that if they're having a rough day, that they can decide not to take a test necessarily. And I think as the parent, you can judge whether it's good, it's bad, or it's indifferent. But my son, Timothy, for instance, he graduated college in 3 years. You know what I mean? So he was, although he was on this plan, it helped him tremendously. And it wasn't an excuse to get out of class or he didn't do homework or anything like that. It does take a great deal of monitoring by the parent, but it's well worth it. Okay. And now they're all adults. And I put very expensive because back in the 90s, we spent a ton of money on this disease. Although we had insurance, it still was a lot of out of pocket.
Right.
Okay.
Yeah.
Yeah. So, okay. Next slide, please. So my story was published back in October of 2003. Dr. Stephen Levine, who's the allergy research group, he called me and said, Sue, we'd like to write a story about you. And I kind of did a look over my shoulder. Me? What do you want to write a story about me about? But it was wonderful. First of all, I told him I'm not a writer, but I'd be more than happy to share whatever I could if it would help somebody, because I just knew all that I went through so far in about 8 years at this point. So he wrote up the story of one woman's journey through Lyme. It's in the Focus magazine from Allergy Research Group. It's a great article, not only on Lyme disease, but it also included the introduction of cat's claw, which is also cemento or prima una de gatto. Okay, they're all the same thing. And this is where I first saw about Lyme being the great imitator. There was a Dr. Joanne Whitaker, who was a prominent international medical researcher, and she said that Lyme is like syphilis. It attacks multiple organs, and it mimics many diseases. So then Dr. Whitaker went on, and she listed them, and she included ALS, Lou Gehrig's, which I was told, chronic fatigue, fibromyalgia, irritable bowel, multiple sclerosis, and Parkinson's.
Wow.
And it's funny because my dad was just diagnosed with Parkinson's in the last spring. Like I said, he has had Lyme for many, many years and whatever. My dad passed away September 3rd, but I took him to 2 different doctors when I brought him up to New Jersey here, and both of the doctors looked at him and said he has Parkinson's. And I just had a little smirk on my face, like, it's Lyme. It was really funny, but that's a whole other story.
Wow.
So anyway, like I said, this is the first time I saw that neurological degenerative diseases could be Lyme disease. So this was huge for me because I was saying this for quite a couple of years, and nobody would believe me. Everybody called me the Lyme nut. That was my, whatever. I'm just trying to help people. Next slide, please. Okay, so the point is what I ask my patients, and when I see people or people call me, I say, how do you feel? And people say, I feel good. Then I say, then why are you calling me? And then they say, no, I'm only kidding. I don't feel good. I feel terrible. So I say to people, and I'm just talking about the general population. I mean, if you look at people walking around today, everybody is exhausted.
Yes.
And I say, are you sick and tired of being sick and tired? I'm 60 years old now. I have fantastic energy. It's 7:30 at night. I can go till about 10:30, 11, and then I'm sound asleep till 7 tomorrow morning. No alarm clock. I feel fantastic. Okay. Don't drink coffee, but I just want to say that that's how you should feel. Okay. But what I see is anxiety, fatigue, not feeling well. So what's the question? What's causing, what's instigating all this within us? Everybody loves that word stress. Okay. And they go, you have to learn how to deal with your stress. Well, what the heck does that mean? Deal with your stress. I can't slow down with the amount of children I have. I have 4 grandchildren now. I work a lot of hours. I love what I do. I don't even call it work. I just love what I do. But that's the whole point. We can't deal with our stress, but they can blame stress. Hormones, is that another thing? Are your hormones off? And then if that is, what does that mean? Hormones, poor diet. Are you bloated? Are you gassy, belching, acid reflux? Again, people will blame that on age or whatever. We've talked about genetically modified foods, preservatives, herbicides, pesticides, etc. Dental is a huge issue that I think needs a lot more attention to talk about today, especially mercury fillings. I ask my patients, literally, I look in their mouth and say, you got any mercury in there? See what's going on. So anyway, and then the pathogens, I think, are the number one thing, obviously. Bacterial, viral, parasites, protozoa. Around the full moon, and you can start tracking this. If there's a full moon or coming up to the full moon, do you feel agitated and irritated, and you just feel something's not right? Is your nose itchy where you're rubbing your nose? Are you scratching your head? And it's also anal itching. I'm sorry. I talk about everything in my practice because I want people to know because they don't know where else to ask somebody.
Right.
The full moon is known as the dance of the parasites. So that's why you might be irritated more towards the full moon. Okay. And the question is could it really be Lyme disease? And again, I'm not saying that it's just Lyme. Okay. Next slide, please.
Okay. That's very interesting because we all know when it's a full moon in the office.
You betcha. Yeah. And that's why. That's why. And the craving for chocolate, when all the women want chocolate, it's because they're lacking magnesium. You start taking that magnesium lactate and you'll stop craving chocolate. I was one of the, I love chocolate. I used to eat it, chocolate milk, chocolate. I hardly eat chocolate anymore. Magnesium lactate. Okay. Lyme. Yes, thank you. Being a gram-negative spirochetal bacteria, similar to syphilis. Basically, this is called Borrelia burgdorferi. It's an anaerobic bacteria, so it lives without oxygen, which means it loves the retina. The back of the eyes is one of its favorite places. Okay, so if you have vision problems and you're not sure what's going on, when people talk about macular degeneration, what is causing it? Well, let's think maybe there's a spirochete back there chewing away.
Oh, wow.
Which is just what it does with multiple sclerosis. Multiple sclerosis, it's eating the myelin sheath. I personally do not believe in autoimmune. I don't believe in the body that God created our beautiful bodies to turn on themselves. I believe there's pathogens instead that are chewing away and surviving very nicely within us. Okay? So Borrelia can change its shape. It can go from a spiral pigtail shape to a filament, to a cyst, to a granule, and then it's a hooked rod or an elbow is what it's called. And these variants are then called L forms. So it goes from a corkscrew shape to an L form. and then they're cell wall deficient. So that's the problem with it, okay?
Mm.
And from there, they also change and adapt, and they go into a cystic form. And when they're in a cystic form, they crawl up like in a little ball, and they create a shell over them, a hard-core shell called a biofilm.
Mm.
And a
Oh,
biofilm,
really?
yeah, and a biofilm is like a little colony of bacteria. So if you take fresh flowers, put it in a vase, and then let it sit for a while, that little bacteria starts growing. You start getting slime all around the flowers and the water. Leave it for about a week and come back and look at that water. That's a biofilm, okay?
Oh, wow.
But when you have this biofilm encasing with the wolf inside, which is the Lyme spirochete, and the outside is this calcium hard shell, which is the biofilm, here comes an antibiotic. And guess what it sees? Nothing. That's why antibiotics don't work all the time.
Oh.
Okay?
Mm.
Okay, next slide, please. Okay, so these are just pictures of ticks so you can see obviously how tiny they are. The adult ticks lay their eggs in the very early spring, and the larvae hatch from them in the summer. And it takes about a month for the eggs to hatch once the temperature is warm enough. And then the peak larval activity occurs in August. The larval ticks are tiny. They're the size of the point of a pencil, like the one like I saw on the back of my hand, and that's when I got bit. After they hatch, they attach to the host and they begin to feed. Now, if I don't know who sat there with watching a tick to see how long it takes for it to regurgitate its guts into the body, which releases all the toxins and so forth, okay? I think within the first minute, because when they stick their head into you, they put in a numbing agent. That's why you never feel them. And then they regurgitate their guts, and that's what all the infections are. That's where they all come from.
Wow.
So these ticks at that time go for the smaller animals, one that are close to the ground, and they usually feed for about 3 days and then they drop off. So then the nymph is the bigger one, and they begin in May, and they're very active throughout the summer. And these are the ones that are highly infected. Those are the ones you got to really be careful of. But now, as warm as it's been this fall especially,
all right.
Adult ticks emerge from October till November, but they're still out today. I just saw people the other day. I was driving down the end of my street here. There's a little bit of woods. I see people in there with their little 2-year-olds, like sitting in the leaves in the woods. And I'm like, oh my gosh, I can't tell you how it kills me. I want to stop and go and just tell them what's going on and what's happening.
Right. Wow.
Anyway, yeah, these are the ticks that attach to people. Next slide. Yep. Next slide, please. Okay, so these is just a chart. You can see already it's 3 years old as of 2014. But basically, and a lot of people in the Lyme world know this. They hear that we're only reporting about 30,000 cases of Lyme per year to the CDC. Well, my 8 cases didn't get reported at all because they weren't CDC positive, which I'll explain later, okay? The point is that there's a lot more cases of Lyme disease out there, and they're even predicting 10 times higher. So if it's 30,000 a year times 10 years, you're talking about 3 million new cases every 10 years.
Wow.
Now, then the other thing about this is that Lyme is gestational, meaning that it passes from the blood of the mother to the baby. It's sexually transmitted, and it's also it can be through blood transfusions. So there's all kinds of ways of spreading this other than just, you yourself getting bit by a tick.
And Dr. Sue, it's not just from ticks, right? I mean, couldn't you now get it from spiders or
fleas,
mosquitoes?
flies? Fleas, flies, mosquitoes. They're, and again, this is all so controversial. So, I mean, I just encourage anybody that's, questioning or whatever, just do your own research, but it is out there. The research is definitely there because I've seen it.
Wow.
Okay.
Next slide.
Next slide, please. Yes. So how we deal with Lyme, or I deal with Lyme at its core, is diet is number one. What you put in your mouth is very important. I am not a fan of any particular diet. I don't prefer one over the other, but these are just some of the examples of what's out there today between the ketogenic, the GAPS, the DASH, low fat, low sugar, et cetera. I do highly, highly recommend organic and non-GMO. You really have to read your labels. It's amazing when you pick up a box or a package of anything and read really what's in it and look for that word genetically modified, because it is on some labels. But they don't have to label everything that is today, unfortunately. But they're trying to push for that. But anyway, supplements. Use the best you can. Use organic whole food supplements. I had a gentleman the other day brought in 26 bottles of, I won't say the brand, plastic, that he said, but Dr. Sue, these were all half price. I said, but you bought 26 bottles of junk.
Yeah.
Sorry, you wasted your money, you know.
Yeah.
But
Right.
that's fine. He was willing. I asked people, sometimes just put him aside for 1 month and let's just try something because he was getting nowhere, absolutely nowhere. So,
Yeah. Right.
just let's
Yeah.
try something else for a month and then we can always go back to these. They're not going to go bad, so
Right.
let's just try that. Exercise, I say any. And what I mean by that, I literally tell people if they're not moving at all, just please get up and walk out to your mailbox 1 time a day. If it's out in the street or like walk to the end of your driveway and back,
Mm-hmm.
any sort of exercise. Anything to move the lymphatic system is fantastic. So we're
Mm-hmm.
talking about rebounding, jumping on a little mini trampoline. If you don't have one, jump on the bed.
There you go.
I yelled at my kids for years, stop jumping on the bed. But now, jump on the bed. You can
Right.
also stand against the wall, put your arms out against the wall, your hands on the wall, and then push, like little push-ins. So you pump
Yeah.
your ankles is the whole idea. Pumping your ankles is what moves your lymphatic system. And
Really?
yep. And your
Okay.
lymphatic system is 45 pints of fluid. So that's a lot of fluid to be moved. Okay. So
Okay.
rebounding, dry skin brushing is another thing. When you dry skin brush from your fingertips to your heart and from your toes to your heart with a soft bristle brush, 2-3 minutes before you get in the shower or bath, works great also for the lymphatic. Okay.
All right.
And then we also have, I use the Rife Machine, which that's what I started with way back in the 90s. And then a PMF, which is a pulsed electromagnetic field therapy. Next slide, please. We'll go over these.
Okay.
Okay.
Uh-huh.
The Rife Machine, Raymond Rife was his name. In 1929, he built a microscope back then, which was capable of a magnification that magnified things greater than anything else at the time. So with it, it made it possible to see some very small germs. And that's never been seen before. So Rife was given, at the time, 16 late-stage cancer patients to treat with his frequency instrument called a Rife machine. Okay? All 16 of these people recovered.
Mm.
So this was, again, like kind of way ahead of his time. But Rife is an alternating current machine. It's a positive and a negative. It's a vibration machine. So it's like the woman, the opera singer that sings that perfect note.
Mm-hmm.
She's singing the frequency that glass is being shattered in her hand. That's exactly what it is. It's a frequency. Everything is a frequency in this world. Everything has electricity to it, even us.
Mm-hmm.
If we don't, we're not living. Okay?
Right.
Okay, next slide, please. This is another machine that I have in my office called a PEMF, Pulsed Electromagnetic Field Machine. This is a DC machine. The Rife is an AC, alternating current. This is a DC or direct current. And it's like a battery chargers. So your batteries, your cells inside your body are little batteries, and this is a battery charger. So the PMF creates a series of safe, gentle magnetic pulses that travel from the unit through the loop, and then it stimulates your cell. It's what they call a ringer and a hummer. So it comes in and it hums into the nucleus of the cell while it dings the cell like a little hammer on a bell. So it rings it as well, and it stimulates the cell. So the cell membrane opens up, dumps the toxins, and it can now receive nutrients.
Wow.
Yeah, and I use this a great deal for frozen shoulders, for sciatica pain, for Parkinson's shakes. I used it on my dad to absolutely stop the shakes. You just loop over the head. There's various positions and so forth, but it's good for somebody who has a knee that hurts or a swollen knee, or they're hurtsing. When you feel lousy, like die off from Lyme and so forth, and you kind of feel achy and flu-like. We do it over the brain and so forth. It works fantastic, and it's as little as 3 to 6 minutes. It can be done.
Wow.
Next slide, please. So how to deal with Lyme at its core is, glutathione is, one of my star things that I'm using lately. And not IV. I did glutathione with phosphatidylcholine IV pushes. I've done those years ago. But now the glutathione we have today, most vitamins now are liposomal, which means that they're wrapped in little fats, phospholipids. And what it does, liposomal delivery of vitamins, takes that vitamin and puts it directly into your cells. So it's awesome. So glutathione is fabulous for liver detoxification, which is one of the great things. Mm-hmm. And phosphatidylcholine is some of the fats that feed the brain. So it's great for dementia, Alzheimer, that type of thing, along with coconut oil. But anyway. Mm-hmm. Okay, I also use essential oils. You can use transdermal. You can also use some internally. That's just, some of it. Sauna, infrared sauna, fabulous. heats up the body within 4 inches deep into the body and so forth. Hyperbaric oxygen, ozone, dental. Again, dental issues are huge. I'm not going to go into a big deal about that right now because that's not what this is about, but just to let you know. I also use a Zyto machine in my office, ZYTO. Zyto is fantastic because it's a simple galvanic skin response type scan, and it helps inform me as to what is going on with somebody within their body. It does a reading, so to speak. It scans with a little hand cradle, and then it's a unique signature of each patient is then recorded by the software, and then it tells me what's going on for that person. So it's really cool.
Wow, that sounds great.
Next slide, please. I just threw this slide in. Sorry, this is the tooth chart. This is fascinating, so if anybody ever wants to look at this, I myself, it was my tooth where, I didn't write it down here, but it was my tooth in my upper right, which is connected to my right breast, which is where I was told intraductal carcinoma. Turns out I had a root canal there with a crown. And not only that, but it turned into a cavitation, and I had to get the cavitation all cleaned out and everything else. A cavitation is like kind of rot above in the bone and so forth. And I had to have a cadaver bone put in and so forth. But isn't that interesting? That's where the right breast is, in that same area.
Yeah, I think we've got 8 teeth that are connected to our mammary gland. So I like to see every woman do at least one thyroid dental study. Because you got to get the dental infection cleared up if you're, if you're suffering from any breast or anything, heart. It's connected to all these organs. Yep.
Absolutely. Okay, next slide, please.
Yep.
Okay, so I threw this in here because a lot of times I see patients, and I'm going to be just totally honest with you, they have no money. They can't afford, $100 worth of supplements or, whatever. So I always feel like I have to have something for everybody. And I love the Salt Seed Protocol. Mark Fett is a dear friend of mine. He wrote this book. You can get it on Amazon, the Salt Seed Plus Protocol for Lyme infection. And basically, Mark was diagnosed with Lyme. He compiled all this information. It's a publication about taking Himalayan or sea salt along with 1,000 milligrams of vitamin C. Salt is a natural antibiotic. Okay, so again, you don't use table salt, sodium chloride, which is a chemical. Throw it out. You have it in your house, throw it out. Do not eat it. You want Himalayan or sea salt. And then you take the dose, and all the explanation is in here. But again, I'm just introducing this. Okay, it's just an idea. Very inexpensive. And children can make it also. We came up with a little type Gatorade drink for children so they can take the Salt C also. Okay, next slide, please. Okay, so the next two, this slide and the next slide are just some symptoms that I put down as far as Lyme, because people say, I didn't see a tick, don't have the rash. Yeah, I get headaches. Everybody gets headaches. No, not true. I don't get headaches, okay? Shin splints, fevers, sweats, chills, fatigue, et cetera, et cetera. Unexplained hair loss includes your eyebrows. If you find that your eyebrows are sort of falling off at the ends, especially eyelashes, your hair is brittle and breaks and so forth, there's reasons for this. Don't just accept it, Swollen glands. I told you about my strep that I had. Okay, next slide, please. Lyme loves the bladder, so please pay attention to that top one, irritable bladder / dysfunction. I tell my women patients especially, they're like, well, I don't have irritable bowel, or I'm sorry, I don't have an irritated bladder. I don't have, whatever. And I say, well, have you ever had UTIs? Well, I used to a long time ago. And when I do a Zyto scan, the first thing that comes up for almost every patient all over is urinary bladder. And that's Lyme. Lyme loves the bladder. And, like I say, I see many patients with bladder cancer as well, so you can see where it's coming from. But this is just a long, just some of the things on here. That's all. I just wanted to show you the some of the symptoms. Okay. Next, please.
Okay.
This is just a quick sample of testing. These are some of the labs. This is not a complete list at all. Again, if you have insurance and you can put it through LabCorp or Quest, my suggestion is do it first. Why not? Before you spend big money on these other labs. I did my LabCorp in October, and I came out highly positive for Lyme. Well, gee, what a surprise, but I feel great, So the question is why? The reason why I'm still high is because obviously I still have it within me, but I feel fantastic because my immune system is strong. That's what the difference is. Okay. You also have labs like IGeneX and Pharmacin and iSpot. These are just some suggestion of a couple of places. Okay. Next slide, please. And the big question is, why are so many people told they are negative when they are actually positive? What happens is a lot of times the first thing they test is a Lyme titer, which does not work. Some doctors will even start with an ELISA test, ELISA, not good. The third is sometimes they'll do a Western blot, and the Western blot will come back with 1 or 2 bands. Like mine just recently came back with 2 bands with 39 and 41, which I have in the later slide here of what all the bands are. But 41 is the tail or the flagellum of the spirochete. And as the Lyme doctor told me back in 96, Sue, if you have band 41 and you have a piece of the Lyme spirochete, and I was at an outer surface protein C, which is a piece of the spirochete, he goes, it's sort of like being pregnant, being sort of pregnant. And I'm like, okay, I get it. Either you are or you aren't. He goes, obviously, clinically you're diagnosed. Okay. Right. So the IgG on your Lyme test you've been exposed to Lyme. It could be in the past, and IgM is current infection. That's just a quick, trying to explain it to people.
Important stuff there.
Yes. Very important. Yeah. Next slide, please. Okay, so these are just this tells you that you need 3 out of 5, 5 out of 5 to qualify to be CDC positive. But again, if you have a piece of something in you, you got to question, am I going to trust that I'm negative for Lyme, or should I do something about this, especially when you put this together with the symptom list? And if nobody else can figure out what's wrong with you, I don't need somebody to be positive for Lyme to come see me. That's the beauty of it. I told you, I'm not a medical doctor. I'm here to work with you holistically. If there's something wrong, we're going to go to the root cause. That's what a naturopath does. So I don't go to your migraine and say, well, let's see, you're missing some Tylenol. Let's give you Tylenol and your migraine's going to go away, or Imitrex or whatever prescription drug. That's not what it is. You have a migraine because you're dehydrated. You're not drinking enough water. Number 2, it's hormonal. It's usually an estrogen surge, okay, but it's hormonal, an imbalance in the hormones. And number 3 is toxicity. You're holding on to a great deal of toxicity, which is coming from the gut. The gut's directly linked to the brain. So you clean that all up. I had horrible migraines back in the 90s. I don't have any headaches at all. Wow. Okay? Next slide, please. It's number 22 to 39 here. These numbers here are just the different bands, are what they're called for the Western blot test. The lower the number, the more significant it is. And the most significant is probably from 23 up to about 45. And then, that's about it. That's your more significant bands. Okay? And that's the next slide, please, which is the end, number 41 to 93. 41 is the one that I had. Okay, and I ended up paralyzed, so.
Wow.
Okay, next slide, please. Okay, so let's relax here and take a deep breath.
Yes, that was a lot of information. Scary information.
Nope, it's not scary. Okay. What I tell people is the best thing for fear and anxiety and unrest and whatever's bothering you is knowledge and wisdom. When you learn something, you're no longer scared. Okay, so you have to be willing to look at yourself and say, I deserve to have a healthier life. I just don't know what to do, or I don't know what's going on with me. So that's where you go and you seek somebody like me to help you figure out what's going on and how to fill in the gaps. Okay, next slide, please. Okay, so Lyme is not alone. When you are diagnosed with Lyme, there's usually a multitude of what they call co-infections. Co-infections are what goes along with. So these are just some of them, and I circled a couple of them, like Babesia, Bartonella, Mycoplasma, Epstein-Barr virus. My Epstein-Barr virus was off the charts. I just had it tested, and it was almost 400. Anything above 21 is positive. Again, why am I not fatigued and strung out in bed? Because my immune system's strong. Yeah. Okay. Babesia is, to me, the biggest problem. Everybody says it's Bartonella. I personally will disagree. Babesia has been my biggest thorn in my side ever. It's a protozoa. It's a parasite. And what Babesia does is it kills your red blood cells. So if it kills your red blood cells, then you're going to have less oxygen, because that's what red blood cells do. They carry the oxygen throughout the body. If you have less oxygen, you're going to have fatigue, overwhelming fatigue, shortness of breath, tachycardia, racing heart. You can get pain where your bra strap is. You feel like you need a chiropractic adjustment. There's a deep pain right in that area. Sorry, men, it's the middle of the back for men. Feet hurting, any sort of, heel pain, sweats, night sweats, day sweats, and it's the person that just doesn't care. You know you need to go somewhere, you know you need to do something, but you are procrastinating to the 11th hour. That to me is babesia. Mood swings is a big part of it. Anger outburst, big part of babesia. Okay. And Bartonella is the other one. Bartonella is part, also they call it cat scratch fever sometimes, with the symptoms being fatigue, low-grade fever, headaches, ringing in the ears, swollen glands is usually a telltale, and usually it's stripes also that look sort of like stretch marks, rashes, that type of thing. Okay, muscle pain is another big one for Bartonella. Next slide, please.
Okay.
So what could you do? That's the question. What do you do? I give everybody 4 options. Number 1, find a Lyme literate medical doctor, an LLMD, okay, which I'll show you later in the presentation where you can do that. Number 2, find a holistic healthcare professional, and I say that is versed in Lyme. I personally want to go to somebody that has had what I am being diagnosed with, that has recovered, so then I can say, what did you do and what do you know? As opposed to somebody that's just reading it out of a book. Okay, that's just my personal opinion. Number 3, you can work with both a medical doctor. I have patients on antibiotics and whatever else they're taking, and I'm still working with them holistically. You can do both. There's nothing wrong with that. Mm-hmm. And number 4 is do nothing at all. I had maybe 3 patients I've seen in the last 20 years, and all 3 of them came back to me and said, you were right, I have to do something. But I literally said, do nothing at all, and they left. And I said, okay. Yeah, that's funny. Next slide, please. So as far as protocols, like I say, you can do medical, which is your antibiotics, antiviral, medications, I'm talking about prescriptions, antidepressants, etc. Holistic, more like I said, organic whole food vitamins, lots of herbs. I love MediHerb because they're literally prescription strength. They're so potent. They're so good. If you're starting to come down with the cold or flu, you want a bottle of Andrographis and Echinacea in your hand. You start popping those little babies and you will not get sick with the flu. Okay. Also homeopathic remedies, diet. We talked about eating food and so forth, and water. Okay. Hydration, drinking half your body weight in ounces. Okay. And when I get little bitty women that come in, they're like 100 pounds and they're telling me they're drinking a gallon of water a day. Too much water. You're washing your minerals away. You do not want to drink that much water. Okay. I also have a homeopathic remedy called Rehydrate, and it's fabulous because you put a couple of drops in, whatever water you're drinking, and it really helps nourish your cells and brings the water into the cells better. It really is great. And one of my big things lately is meditation and prayer. Get the toxic people out of your life. I say that with an exclamation point. And if it's family, just tell them you're taking a break for a while, which I just did. Yes.
Okay.
Yeah, and toxic news. You don't really need to listen to lots of negative toxic news, which is all over the media today. Really, does it really matter if we know all the gossip or whatever is that's going on? And I won't even go into it. The nonsense is what I'm going to call it. It's not going to. You're not going to change things, and it's not going to affect you. Just stay away from it. Okay. Next slide, please. And what my philosophy is start with the immune system. The body's made up of 100 trillion cells. You need to nourish and feed the body properly. Supplements, like I just said, hydrate with water. And basically, there's inflammation. That's what the problem is, okay? The body is on fire. So one of the things that I do is I use a Spectra cell test. Spectra cell, it's SPECTRACELL, one word. SpectraCell.com is a micronutrient test. What it does is it doesn't tell me what vitamins you took this morning. It tells me at a cellular level where you're at with your vitamins, your minerals, your essential fatty acids, your amino acids, which is your protein. You could be eating steaks and protein all day long, but you're not breaking it down and assimilating it, bringing it into your cells. So SpectraCell is one of the things I do in my office. Okay, and the other thing that I didn't put on here, Alicia, that I was thinking was elimination was another one. Detoxing the liver, the kidney, the lymphatic, and the bowel. Okay, next slide, please. So what I've observed, what I've been observing, especially the last 3 or 4 years, is previous tests that patients share with me that show, whether it's a CBC or whatever documents they have and so forth, and it could even be Lyme tests, et cetera. But a high percentage of what I'm seeing is obviously high blood pressure. High blood pressure, which has a lot to do with low magnesium in the body. Believe it or not, magnesium lactate would help tremendously. It's also kidney congestion, has a lot to do with high blood pressure. Okay. High cholesterol is another one that I see all the time. Again, things like ceruta or garlic or red yeast rice. There's all kinds of things about cholesterol. It's not changing your diet. It's actually liver detox. I had high cholesterol in September when I got my blood tested. I didn't change my diet at all. 1 month later, I had it tested again. They were in almost 300 in the triglycerides. My triglycerides in October were 100. All I did was I just did a lot of liver detox in the 1 month time. So see, that
Wow.
I wanted to prove something, and that's exactly what it was.
Wow.
Okay. So
Okay.
you're high. I'm sorry. Go ahead.
No, I was just saying, wow, that's amazing.
Yep. Deep breathing is another, getting enough oxygen, deep breathing, slowing down stress, et cetera. Your LDLs, your lousy cholesterol, your HDLs, your happy cholesterol, again, has a lot to do with B vitamins. B vitamins and magnesium is a big part of it. I see a lot of high C-reactive protein, high fibrinogen, which is little fibers in the blood, so to speak, insulin resistance and so forth. A lot of this is inflammation. There's just tons of inflammation. The body's on fire inside, okay? And what we have to do is put the fire out. So I do it with what I call my natural antibiotics, my holistic, which I'll show you in a minute. But boswellia, frankincense, gotu kola, Korean ginseng, turmeric, these are all great, for inflammation, and for the high fibrinogen, I use Baluchi, which is fantastic. Okay. It eats up fibrin and cysts and tumors and so forth. But again, inflammation, like I say, gut dysbiosis, the gut is upset. The gut is on fire. Okay. We got to put the fire out.
Mm-hmm.
So the number one thing I see, basically what I've observed, is fatigue. Adrenals. The adrenals are burned out, okay? We're burning up the adrenals, which means the thyroid is heavily affected. So between the two, we need adrenal support and thyroid support, which is iodine, okay? And then there's also herbs for that as well. Next slide, please. So what is the cause of the inflammation? Diet, number one. If you were to sit and record what you're eating every day, literally, and you're not going to show anybody, and you don't have to show me. What I'm trying to say is literally write down everything you put in your mouth for 24 hours, okay? Or do it for a couple of days, whatever, and see what's happening. That creates your acidic tissues when you're eating sugar and carbs. And people are like, but I saw a lady at church the other day, she fainted, okay, this older lady. And I went and I said, oh my gosh, honey, are you okay? Whatever. They stopped the service. And I asked her, I said, what did you eat this morning? I had a piece of toast. I had some raspberries and a glass of orange juice. And I said, but sweetie, you didn't have any protein. She goes, I did. I forgot to eat my eggs this morning. I said, that's why you fainted, because you have no protein. You have no substance.
Right.
And she said, but I did. And I said, no, you ate sugar. She goes, I didn't eat sugar. I said, but that's what all that is. It turns to sugar. So we need that protein to stabilize the blood sugar. That's what creates your acidic tissues. Lack of exercise will cause acidic tissues. And then I always point to infection. There's always bacterial, viral, and like I say, protozoa parasites. Mm-hmm. Okay. The next couple of slides basically are, we're not going to go over these, but basically it's superfoods to help decrease inflammation. This is just a list of stuff that I put together. It's the superfoods. The next slide, please.
Yep. There we go. Got it.
Thank you. Yeah, the superfoods to decrease the inflammation. And like I just said, I'm not going to go over all these. You can go through these. Cruciferous vegetables. I'm going to tell you another really good story. Cruciferous vegetables are what DIM is, or indole 3-carbinol. And what those are is they cut the bad estrogen, okay? So if you're having cystic breasts or calcified breasts and fibroid tumors and all this type of thing, you're holding on to the bad estrogen, the estradiol, okay? I was guilty of it myself with big fibroids, okay? Cruciferous vegetables. And I saw a gentleman not too long ago that came in that has gained weight. And he came in, and I'm going to tell you because I know this is funny, but I don't mean to be funny, but he basically said, I have man boobs. What can I do about this? This just started. And I said, you're very estrogen dominant. This testosterone is turning into estrogen. So what I did was I put him on the Zytoscan. First thing that came up for him on the list was DIM. DIM is for estrogen for women. But it's not just for women. It's for men also. We forget about the men.
Right.
I don't.
Yeah.
I'm like, come, tell me. Let's figure out what's going on. So that's your cruciferous vegetables. That's the same thing as DIM. Okay? Next slide, please. These, again, are just foods to decrease. I know a lot of people say no grains whatsoever, but I'm just trying to point out for people that do eat grains as well. I'm not here to, make a specific diet or specific suggestion for anybody. This is just showing you some healthier foods that are good for inflammation. And the third slide, please. Again, always green leafy vegetables. And I know there's a lot of green powders out now and a lot of red powders and, all kinds of powders, whatever. It's really best to eat organic whole food as much as you can, like I say. Okay, next slide is about herbs and spices. Again, I've mentioned turmeric earlier, curcumin, capsicum, ginger, garlic, all these great herbs and spices. Beware of food allergies. Again, food allergies are what one doctor that I learned from years ago was a course I had to take in my ND course. He said they're not food allergies. They're actually called metabolic antagonists. What a metabolic antagonist is when you're eating something because you're actually lacking something else. So in other words, if you have an allergy to tomatoes and citrus and that type of thing, it's usually a potassium deficiency. If you have allergic to wheat, it's usually a magnesium deficiency. And according to this doctor, when you're getting everything in balance, you will no longer have food allergies.
Oh, wow.
And I think I personally think that's true. I really do. I had tremendous food allergies. I don't have them anymore at all. So then I just listed a couple of typical food allergies. And on there, I forgot to put nightshades. And again, there's many other food allergies that are out there. I just wanted to just give an idea.
Okay.
Next slide, please. These are just additional, avoid the bad fats, which is called the arachidonic acid, which is your meat and dairy. I'm not telling you do not eat meat or do not eat dairy. Again, it's a personal choice. But if you do, I eat grass-fed. I eat organic. If it is dairy, like a little yogurt once in a while or something like that. If you're lactose intolerant, please don't eat dairy. Okay, I'm just trying to give you an idea.
Right.
Okay, and then the good omega-6. Don't buy your oils in a plastic container like I don't remember what's the corn oils, like the Mazola.
Right.
Okay. Buy your oils in glass. It really makes a huge difference. Okay. You want to buy them in glass. Okay. Next slide, please. And then here I just listed a couple of good a couple of good fats like coconut oil. Coconut oil is fabulous for the brain. It's a medium chain fatty acid. It is not a bad fat. I don't care what your medical doctor says. It is not a bad fat. Coconut oil is fabulous for the thyroid. It's also helpful for losing weight. Now I just got a bunch of people's attention. Coconut oil, fabulous. 1 to 2 tablespoons a day. Great for dementia and Alzheimer's. Okay. And then the rest of the oils here, grass-fed butter makes a huge difference. That's all we eat now in my house is that. And nuts and seeds and so forth. Okay, next slide, please. Sugar in any form is detrimental to the body. We all know that, but we still eat it. It's like an addiction, okay? Once you start with the sugar, you can't stop. They actually know it is a brain stimulant, and it's just, no offense, but it's just as bad as cocaine. Sugar feeds bacteria, okay? The Lyme it's bacterial, loves sugar. That's what it thrives on. And you know what else it thrives on? Fungus. Fungus loves sugar. So again, people come in and I ask them about yeast and fungus and so forth. They're like, no, I don't know. I don't have a yeast infection, whatever. And turns out they do. What happens is the stomach is low in hydrochloric acid, usually with Lyme patients, but actually most of the adult population, we have low stomach acid. So I give people HCl, hydrochloric acid. And you're like, what's that? It's literally organic beets in a bottle. Okay, little capsules. So you take that with a digestive enzyme, breaks your food down. Now your food turns into total chyme liquid, goes down into the small intestine, and then you can absorb it. If your small intestine is full of yeast and goop, you're not going to absorb your nutrients. Okay? So when people say I don't absorb my food, probably one of the reasons is because you got fungal infection, yeast. Okay? And it's due to low hydrochloric acid, low stomach acid. Okay. Some people say, well, I take apple cider vinegar. Okay, that's good. But apple cider vinegar, you got to be real careful. It takes the enamel off your teeth after a while. So you don't want to be on that long term, really.
Right.
So the better choices are the ones that I listed here. Okay, next slide, please. Remedies, I use various protocols for my patients. Like I said at the beginning, it's an individual situation. I use hydroxyl silver, oregano, olive leaf, the salt sea that I talked about. Berberine is fabulous, fabulous. Antimicrobial berberine is fabulous for blood sugar. Okay, any blood sugar issues. If your blood sugar is high, you're going to keep carrying the yeast. You got to get the blood sugar down, the pancreas. Okay. One of the things I say also is has a lot to do with gallbladder, which sits underneath the liver on your right side. The gallbladder usually makes bile salts, but a lot of times Lyme people don't make bile salts, so their gallbladder gets congested, which gets congested between the gallbladder, the bile duct, and where the pancreas, the head of the beginning of the pancreas is, where the bile duct is, and the duodenum. And the Lyme loves that area. It gets all gunky and gooey, so I got to get in there and we clean it out.
Mm.
So berbeриne's great for that also. Cat's claw, essential oils, etc. Antiviral. Viruses run up and down the backbone. So when you have a lot of back pain and so forth, it can very much be connected to viral infection. Okay, and again, I see that in a Zytoscan. So oregano, olive leaf, what I've listed here as well. But my biggest thing that I try to teach people is build your immune system.
Mm.
Absolutely build your immune system. I have not been sick, not a cold, not a flu. My husband was just deathly ill with the flu. I'm all around him. I don't have it at all. My immune system is very strong. I take transfer factor multi-immune every morning, 2 of them every morning. I try to put everybody on it because it's fantastic. Build your immune system. Mushrooms, great for that also. Acupuncture, massage, sauna we talked about earlier, and so forth. So the last thing what we want to do is I talked a little bit about detoxification of the liver, the colon, the liver, the lymph, and so forth. And what you want to do is you want to clean up these toxins, because once you kill things, whether it's antibiotic or holistic, you've got to bind these toxins together and get them out of the body. So
Mm-hmm.
I use things like bentonite clay and charcoal, but I don't use individual products. I use GI Detox, which I love. That's along with my biocidin. Biocidin is fantastic for Lyme, antimicrobial, but it also does biofilms. But GI Detox is the same company. Laminaria is another one. Laminaria is a brown seaweed, binds toxins as well. And then also Mechlor is another one that I use. So these are just binders like chlorella, this type of thing. So the bottom line is what my takeaway is take charge of your health. It's your body. You have the choice to do something about it. Okay. And when somebody tells you something, use your common sense and your brain to think whether it resonates with you in a positive sense or a negative sense. If it's negative to you and you try to force yourself to do it, it's not going to work. Don't be inactive, be proactive. Okay. A symptom is the check engine light on the dashboard. You can keep driving, but you're going to end up in the middle of the desert and your car is going to break down. So listen to your body and go according to that.
Mm.
Okay. The
Okay.
next slide.
I have the reference for the LLMD up. Is that the one you
Oh,
want?
yes. Thank you.
Uh-huh.
Yep. And this just just a couple of things. There's lots of information out here. I mean, I'm giving you guys like a thumbnail of
Mm-hmm.
tons of information, but I'm just trying to give you an overall. Okay.
Mm-hmm.
Okay. And then also, next slide, please, is just a couple of recommended readings. Okay, really good stuff. Stephen Buhner and Scott Forsgren and Connie and so forth. So there's just a couple of ideas again, just for sources. Next slide is my sources where I got some things,
All right.
and then the last slide is my office. My
Oh,
office.
beautiful.
Yep. My office is in a church. It was a church. It's a renovated building. It's in downtown Red Bank. It was bought about 2.5 years ago. They gutted the whole thing, and it's completely refurbished. It's known as a LEED building, LEED. It's environmentally conscious, which means that it's close to public transportation, and the inside of the building is all reclaimed wood. There are no harmful chemicals whatsoever in the building. It's all fume-free paint and carpeting and whatever's in there, and it's absolutely beautiful. And I'm at the Jersey Shore, and I am on the right side of the building where the sunshine is. I'm on the south side of the building, and my office is just so blessed, and I'm so blessed to be there.
Yes, and
So,
I do have to say, we do thermography out of this office, and it is absolutely just a beautiful, wonderful office. The energy in there is fantastic. Everybody just always is commenting on that. It just special, special building. Well, we have
thank you.
some questions, Dr. Sue. Let's get to them.
Okay.
Okay. My husband here is working the computer,
No problem. Good.
so here we go.
Okay. Okay.
Just getting down to the bottom. But yes, I told Lauren this will be recorded and it will be available within a day or two, and it will be archived on our website. Fiona, Kristen did answer that question for you, but it will be on there as long as our website is up. Then Laurel lost sound. I hope you were able to get that back on. Ellen asks, how about a lymph star machine?
Okay. I don't know what that is in particular.
Okay.
Okay, I don't know lymph star. If it's something to move the lymph, there's vibration machines. There's all kinds of stuff. There's a lymphatic. I go to a girl here in town who has cleansing concepts, and she has a lymphatic. I don't even know what the machine's called. I have to ask her actually. And it does lymphatic also.
Is that the one you stand on and it vibrates?
Well, that's a vibrating one. Yeah, she has like the little wand that's like you're getting electrocuted, and it does the whole lymph. She does the whole body and so forth. So,
okay.
yeah.
Ellen, if you want to chime in and let us know what a lymph star machine is, that would be great. Ellen also asks which essential oils in particular. I don't know. I don't know if you covered that, Dr. Sue.
No, I didn't talk about specific protocol, specific things. One of the things that's great for Lyme though is thieves. And I'm not a promoter of any particular oil company. I myself use Young Living. I think they're excellent. I'm not I'm a distributor, but I don't sell oils. Like that's not my thing. I have two oils usually in my office, which is peppermint because it's fabulous for headaches, and thieves because thieves is fabulous. Anybody can put it on the bottom of their feet, and it absorbs right into the body. Your largest pores are on your hands and your feet. So you put a little bit on the bottom of the feet, especially for children. It works great. And you can also, I put it in a 00 gel cap and I take it internally, thieves, like 2 drops.
Okay, great. Let's see. Laurel asks, can thermography help diagnose Lyme?
No, because information.
Well, Dr. Getson is right here saying, well, it's where we would see that's generalized inflammation, not localized.
Right, from Lyme disease would be generalized.
Yeah, the Lyme disease would be generalized. So, not with the medical thermography we're doing, Laura, but there is something called regulation thermography that might be helpful with that. That's regulation thermography. Jeannie, I guess when we mentioned saunas, she said most saunas are very high in EMFs, which I have heard. Is there one that you can recommend?
Okay. Again, I don't sell saunas. The one that I got that was recommended to me by Mark Fett was the MPS is the one that I have. MPS. It's in the book, that Lyme salt and vitamin C protocol.
Okay. M is in Mary, P is in Paul, S
yes.
is in Sam. Okay.
Yes, and I have the information, so all you have to do is call my office or email me, and I'll get you the connection to it.
Right, and you can always get one of those little EMF readers.
Yep.
Check EMFs on it. Okay, Kristen, thanks so much for answering Lauren and Fiona. Lydia says, I recently received blood results of IgM, went from 1.17 to 1.3. My major symptom is a crackling neck.
Yes.
I have Lyme. I have Lyme, right? Since I'm being told I'm negative, is there something specific I should do?
Okay. Again, that's one of those loaded questions because I don't know all of what's going on with you. But when you have that creaky neck, that we call it Rice Krispies, or that, just cracks and creaks and whatever. Absolutely. In my humble opinion, I think it has a lot to do with Babesia. But again, I'd have to talk to you specifically to see more about symptoms. And again, I tell people I'm not diagnosing, I'm just making suggestions.
Right. Okay. Okay. So maybe now would be a good time. You could just tell people how to get a hold of you, Dr. Sue. If they want to set up an appointment, do you do consultations, phone consultations, in person?
Yes. Yes, I do. Whoops, sorry. Yeah, I do consultations in my office, which is at 211 Broad Street, 211 Broad Street in Red Bank, New Jersey. I have patients that come from all over the world. I have local hotels, that I have deals with because people come and they stay. That's one way. I also do phone consultations, again, all over the world. I do some Skype. So it's just a matter of calling my office. My email, I forgot to put on here. My email is just my name, which is Sue Massie, all lowercase, SUEMASSIE 45@AOL.com. That's my email address. So you can either call my office or email me. And that's the best way to get a hold of me.
Okay, great. Thank you.
Yes, thank you.
Let's see. Stephanie, do you believe there is a correlation between late Lyme and CRPS, which is chronic regional pain syndrome? Do you treat both?
Right. Again, I don't treat anything, but what I
Okay.
do is I work holistically. Again, I say to people, I don't try to diagnose or pinpoint exactly what it is you have. You can have both, absolutely. But the thing is what's going to relieve your inflammation, your pain, and whatever symptoms you're dealing with. That's why I say it's the whole person of what I look at to see what's happening. I don't have to diagnose and put you in a category and say, okay, you have MS, you have lupus, you have, to me, those are, diagnosis, but I look at the whole and see what's going on. Then how do we untangle this web, so to speak?
Right. Okay. If it's okay, Dr. Getson chimed in on that one since he sees a lot of people with CRPS. He says there is a theory that suggests Lyme can be one cause of CRPS. Many patients with CRPS have other diseases, including Epstein-Barr. Many of them test positive for Epstein-Barr as well as Lyme. So there is a strong evidence, that Lyme is a major cause of CRPS.
Treat the Lyme first.
And he's saying you have to treat the Lyme first.
Yes.
And I'm sure the CRPS would improve significantly.
Absolutely. And Epstein-Barr virus works great. St. John's wort works great for your viruses. People think St. John's wort is for an antidepressant, but you don't take it if you're taking other, antidepressants and so forth. But it's just one of the things because it's antiviral. It's super antiviral.
Okay.
So it's very good. Yes.
Okay. St. John's wort. And Lauren asks, what would the ideal breakfast be?
for somebody to cook it for me. No, what I do for breakfast is, again, some people get up and eat chicken and vegetables or salads and all that. I cannot. I'm a smoothie person. I get up and I have a protein smoothie every morning. I use, you can make your own coconut milk, your own almond milk. Very easy to do, especially if you have a Vitamix. It's the best thing ever. It just mushes it all down, and just, you don't even have to strain the almonds out or the coconut. Drink it. It's good for you, But anyway, I also use sometimes unsweetened coconut milk by So Delicious. Look at your brands. Look at the cartons because they all have carrageenan in it. Carageenan. Carrageenan is not a good product at all, okay? But it's in most of the milks, and they're expensive, so make your own. Anyway, you can use that. You can use either a plant-based protein. I use whey. I love whey. I use mine from Designs for Health. It's the best ever. It tastes delicious. And then I throw various things in it, whether it's organic sun butter, okay, which I love, or peanut butter. I use peanut butter, organic, and sometimes organic bananas or raspberries or whatever. So, and that's about 28 grams of protein. An egg has 6.
Oh, wow.
Yeah. So, and it keeps me full from 7 in the morning till almost noon, and I don't have time for a snack in the morning, but you should, eat every 3 hours or so, a little something.
Right. Okay. Carol asks, does Spectra cell detect Lyme's? I just got blood work today with Spectra cell for fatigue.
No, Spectra cell is not a Lyme diagnostic test. Spectra cell is micronutrient. Okay, again, at the cellular level, but they also have additional tests that they'll do for hormonal, cardio, adrenal, thyroid, that type of thing. But no, they do not diagnose Lyme disease.
Okay. Jennifer asks, will the thermography be a benefit to pay to have done for a child with neuro-Lyme?
I would say it depends on how old the child is. First of all, it will show you the inflammation for sure.
Right.
And thyroid issues, right? If they have
sure, yeah. We'll look at the thyroid, yeah.
I mean, the thyroid. I mean, I would tell a lot. I mean, and again, it depends on the age of the child.
Yeah, I would, Jennifer, maybe give the office a call tomorrow. Let me talk with Dr. Getson about that and maybe be able to expand on that answer for you. He stepped out of the room, so unfortunately I can't ask him, but I would love to be able to answer that for you.
Yeah, that's a good one.
Yeah, or email me tomorrow. Ellen says the LymphStar machine doesn't use vibration, but does use varying frequencies to drain lymph and heal. Oh, that sounds fantastic.
Okay. Great. Absolutely. Anything to move the lymphatic. Moving lymphatic is physically pumping your ankles. Okay, that's what pumps. The heart pumps the blood. The ankles pump the lymphatic.
Okay. Thanks, Ellen, for providing that. Laurel says, do you practice remotely? I think you did say you do Skype and
Yes.
phone consults.
Phone
Okay.
consults. Yes.
Michelle, what was the supplement for the racing heart? I couldn't catch the name. Thank you.
Okay. The standard process was the one thing we talked about. Cataplex E2. Cataplex, Cataplex, means vitamin, and vitamin E is an Edward, number 2. And that's like I say, it's like nitroglycerin. And you chew it, and it releases oxygen immediately. It stops a heart cramp immediately.
Wow.
Uh-huh.
Yeah, I'll have to check that out.
I had to go through this to learn it.
Yeah, right.
Desperate times.
You learn the hard way.
Yeah.
Ellen says, my daughter, 27, is told she needs multiple joint replacements and is seeking non-surgical treatments. Had Lyme, has biofilm.
Okay. Before you go and get surgery for multiple joint replacement, we can definitely do it. You can nourish the body and let it heal on its own. One of the first things would be Ligaplex 2, for sure. Okay,
Is that
Ligaplex
also
2.
standard process?
Yeah. She needs a lot of manganese. That's what's being eaten up, which is the Lyme again. It's manganese. But again, I'd have to, Ellen, I'd be more than happy to talk to you, with your daughter because, there's a lot she can do. I came back from 98 pounds, anorexic, dead, and today I feel fantastic. Like I said, I'm 60 and totally recovered from all the things that I had.
And I can attest to that because when I'm at the office, Dr. Sue's running around doing all kinds of things with tremendous amount of energy and really just vitality. Michelle says, Michelle, thyroid dental test. Where do you get this done? Thank you again. Well, we do a thyroid dental facial thermogram, Michelle, at our office in Marlton, or we've got, I think, 20 off-site locations. I'm not sure where you're located. You can call the office at 856-596-5834 and we'll give you some more information on that. Wonderful test to check for thyroid dysfunction, but also finding dental infections that conventional x-rays are missing.
Mm-hmm.
Laurel, is Lyme related to PCOS?
PCOS is estrogen dominance. Yes, Lyme is definitely a player when it comes to the hormones. Again, I've shared some stories of people with high estrogen deposits and so forth with the cystic breast and fibroid tumors, et cetera, et cetera. So yeah, absolutely. Mostly it's liver, has a big part of it. So there's a lot of pieces to it. It's not just PCOS, one thing, do this and you're done. But like I say, yes, I believe it's related.
Okay. Nate says, sounds like the LymphStar machine is a Rife. I've been looking at the Spooky 2 system.
Okay. Yep, Spooky 2. If you go on Lyme and Rife, there's a group that I'm on. Scott Adams is the moderator. He actually just stepped down, but Scott knows all about the Spooky 2, and his wife has one. He has one. So it's Lyme and Rife is the name of the group. So if you go on, the groups, Yahoo, whatever, and just request to join. And he has a whole, he put out a CD, I think, also about Rife machines. I don't know if the Spooky 2 is part of his CD that he gives out for free or whatever, but that's who I would contact.
Okay. Jennifer is saying her child is 12 with the neuro Lyme. So again, Jennifer, please contact us tomorrow. I would love to be able to answer that question for you after talking to Dr. Getson. Laurel, how do you avoid giving this to a child if you're thinking of getting pregnant?
I know that's a tough one.
Yeah.
I knew after the fact, after 6 kids, finally found out I had Lyme. Okay, too little, too late. But the point is that I tell people, do not have children or stop your life or anything else. My advice, just totally off as a mom, I would advise younger women, get your body in the best shape possible. Build up your immune system, detox your body, clean out the liver and the colon and the, so forth, and get yourself in the best possible shape. Get your hormones balanced. Make sure you're not all estrogen and no progesterone. That's what miscarriages are. I had one. I know now what it is way back. Okay. You're just all estrogen and no progesterone. You're supposed to be estrogen up to the first 14 days, ovulate, drop your estrogen, and then pick up the progesterone. Most women are just all estrogen, okay? So you got to balance your hormones and so forth, and then you'll be ideal for getting pregnant.
Okay, great advice. Heather, do you recommend any essential oils to take internally to kill pathogens? I heard you mention thieves. Any others?
Yeah, I mean, again, they don't recommend some to be internal or not internal. I'm just telling you what I take. I use sometimes I'll use 2 drops of thieves, 2 drops of frankincense. When I do oregano, I use more Physica Energetics, which is a company that I love. It's the #1 company that I use a lot of, and it's Physica, Physica Energetics is the name of the company, and they have a wild oregano, and they're little tiny soft gels. And I take those because it's a lot easier, and they're fantastic. They don't burn. Don't ever take oregano straight up or you'll burn your mouth, your throat, and everything else. So,
Right.
But there's a lot of good ones that you can take internally.
Okay.
Rosemary.
All right. That looks.
Sorry.
I'm sorry. Go ahead.
No, I was just saying, I think rosemary is another one. Thyme, I think, is another one, but when you look them up, in the concordance of, let's say something like Young Living, I have the big, book, their big, thick manual or whatever, and tells you which ones you can, which ones you can't.
Okay, great.
Okay.
All right. Well, we got to all the questions. Thank you so much. Ellen has just chimed in. National Association of Holistic Aromatherapy says that internal use of essential oils is not safe. The FDA says it is used as a drug if taking internally. Okay.
Okay. Well, I'm just sharing what I do. That's what I'm saying. I'm not an oil person, but that's what I do.
Okay. Thank you for that information, Ellen. We appreciate it.
Yes.
So
thank you.
That we've gone over a little bit. I just want to say, Dr. Sue, thank you for this tremendous webinar that you presented tonight. So much information. I mean, you just covered so much. Gave everybody a lot to think about. I encourage everybody to go back. I know I'm going to be going back. I was furiously taking notes here, so go back, listen to it again and again at your leisure, and just please, if you would give everybody your contact information once again, if they want to contact you to set up an appointment or talk with you.
Sure. Okay. My phone is 732-933-4011. So 732-933-4011. And my email address is Sue Massie, SUEMASSIE, the number 45 at AOL.com.
Okay,
and I love that because I'm 60 and I always say Sue Massie 45 and everybody thinks I'm 45.
You can pass for 45.
Thank you.
Yes. So anyway, thanks again, Dr. Sue. It was a tremendous, really a tremendous presentation, and we do appreciate you taking the time to share your personal story with us. I mean, really, we appreciate that you were able to do that. So everyone, you're welcome. I want to let everybody know TDI Health for Awareness webinar series will be taking a short hiatus for the months of December, January, and February. I think we're going to try to restart up in March of 2018. If any of the listeners have a particular topic that they're interested in and would like to hear about, please send us an email at tdi@comcast.net. If any of the listeners are expert practitioners in a field that might be of interest to the group, some sort of holistic healing modality or what have you, or know of somebody that might be interested in presenting, please have them contact me and we'll see if we're a right fit. And on that note, I'd like to say have a happy and safe holiday season to all. I can't believe it's upon us already. Wishing everybody lots of peace, love, and joy, and good health. Dr. Sue, thank you once again. Good night, everyone.